Welcome to the bonus content for the neck pain episode. In this content, what we're going to talk about is the evaluation of someone with cervical neck pain, and then Sandra will be talking about different treatment techniques.
As well as strength, stretches, and manual therapy.
Alright, so let's jump into some evaluation. So the first test we're going to talk about is the cervical flexion and rotation test. So this is a test to identify if there's any mobility deficits within the cervical spine. So your patient will be supine, and then what you'll do is you'll get your hands underneath, holding their head just like that, and then you're going to go into maximal cervical flexion, and then you're just going to go into rotation. What you're feeling for is where, if there's any restriction, you can take a measurement as well. They do have like special devices to actually get a measurement for the range of motion. I believe the cutoff is 32 degrees. If they have less than that, that's restricted. Or you can go off of feel, like if you're going here and you're like, oh yeah, we're not going anymore, that would be the restriction there. Whereas if you're going this way, it's like, oh yeah, that has more motion. So that's what you're trying to feel for. Or a reproduction of the symptoms as well.
If you wanted to do active range of motion just clinically, you could just do what our professors used to like to call eyeballometrics. So you're going to go ahead and take your hands and put them right along the upper trap. And then you're going to ask your patient to turn your head to the left as far as you can. And you can kind of get a feel for, are they touching your hand? Are they close to your hand? Look at that angle. And then go ahead and look to my right. Perfect. So then you can get a good idea. If you have them seated, you can go back to the center. You can have a good idea of their active range of motion in that rotation. And then I also like to do flexion and extension. So what I go ahead and turn facing this way for me. So you're find the spinous process. And then I'm going to take my thumbs and just go lateral to the transverse processes. And you can do this at any level. I usually try to do around, so C7's right here. I try to do just a few inches above that. So not quite the base of the skull, but a little bit lower. Go ahead and I'm just applying just light pressure. In this position, I can also feel just for sponginess, feel on each transverse process and see if one is protruding more than the other. But then once I feel that, I can just go ahead and place my thumbs lightly. I'm going to have my patient go into full cervical flexion, so go ahead and take your chin to your chest for me. And you can see how one of my thumbs is actually moving higher than the other. Go ahead and come back to neutral. So if you look at my right thumb, look down again. My right thumb moves higher than the left one. So I'm looking at about like this. And what's happening is that fascia band, go ahead and come back to central, is taut right here. So because it's taut, my thumb is actually moving in that direction with the tight side. So I now know that this right side, other than the fact that I can feel for spasm or feel for where that transverse process is, I know that this is probably the side that I'm going to want to treat and do some manual therapy on.
So the next test we're going to go over is the Cranio-Cervical Flexor test. In this test, we're testing the endurance and the control of those deep neck flexors. So what you're going to do is you're going to have like a blood pressure cuff right at the base of the skull. So not under the skull, just right under that occiput. And then you're going to inflate it to about 20 millimeters of mercury. And then in this test, the patient is going to bring their chin down like in a nodding motion. They're going to hold for 10 seconds, and then they're going to come up. Their goal is to go up in 2 millimeters of mercury increments. So the first set of 10 is going to be to 22 millimeters of mercury. The second set of 10 is 24 millimeters of mercury, 26, 28, and then all the way to 30. And 30 millimeters of mercury will be the max. There is a way that you can score it as well, depending on the level that they get to. So if they make it to 26 millimeters of mercury and they were able to do 6 reps at 26 millimeters of mercury, you would do 6 times 6 to give you a score of 36. The highest score is 100, so if they made it to 30 millimeters of mercury for 10 reps, that would be 10 times 10, that'd be 100. So go ahead, let's do it again. So you're going to look at, yep, perfect. Good, and then come back down. Try and keep the base of the skull there, and it's just this motion. So there you go. And then grab one more. Try and do one more. Flex. And that is the Cranio-Cervical flexion test. The next test we're going to go over is the upper limb tension test with a specific focus of testing the median nerve. I wanted to include this test because it gives you an idea of ruling out cervical radiculopathy. So in this test, it's going to be broken down into a couple of different steps. The first one is you're going to create shoulder depression. So you're going to bring that shoulder girdle into depression. Then you're going to go 110 degrees of shoulder abduction. And then you're going to go into external rotation with the elbow about 90 degrees. Then you're going to go into forearm supination. And then you'll go into finger and wrist extension. And then you'll go into elbow extension. And then you'll have them go into cervical lateral flexion to the opposite side. At any point in that step, you're looking for any reproduction of their symptoms. So if they get symptoms in the external rotation part, you're not going to keep going more because that's just going to be even more painful. Say if you have an athlete that has a compromised shoulder, like any shoulder instability or just coming off of shoulder surgery or the frequent dislocator, you can basically do everything the same except for instead of going the full 110 degrees of shoulder abduction, you can go to about 10-20 degrees of shoulder abduction. So it's a little bit safer of a position for their shoulder.
So now we're going to move into our deep neck flexor exercises. Randy already showed one for neck endurance. Now we're going to focus more on strength. So this first one, you can do, actually I'm going to show three. There's going to be a supine, a seated, and a prone. So this is the one I like to start with first, just so patients can get to understand where their deep neck flexors are. This one really takes out a lot of the posterior structures, whereas they can really get a focus on the anterior structures where they really should be feeling it. It's very similar to the one with the blood pressure cuff. What I'm going to have them do is hook lying position. If they do have rounded shoulders or kyphosis, then I am going to want to place a book underneath their neck. Go ahead and lift your head for me and relax. Just so that we get that nice neutral spine. We do not want to start them in an extended position. And then from here, I want them to go ahead and tuck their chin to their chest while keeping their head on the table. Good. And relax. They can hold that for a couple of seconds and you can do up to 10 reps. This next exercise is performed seated. This is the one I tell patients that they can do in the car while they're waiting at a stoplight because it just looks like you're thinking. So and I usually do this one again after I have them first supine so they get to feel where their structures are. So I'm gonna go ahead and have my patient set their head. So go ahead and pull the back of your head back towards my hand. Perfect. So find that good posture. You're gonna take one of your fists and put it right underneath their chin like you're thinking. And then what they're gonna do is they're going to tuck that chin down into the fist, just a very light motion. Some cues that could help with this are go ahead and take your eyes and look down to the floor. That helps with that anterior deep neck flexor motion. And then also putting the tongue on the roof of the mouth is another good cue to help them get these front structures. Parameters for this are going to be up to 10-second holds. If they can't get to that, you can shorten it. Start with like 3 to 5 seconds, move up to 10 seconds, and then again, you're going to do 10 reps. This next exercise is the most advanced of the 3 deep neck flexor exercises. So you're going to have your patient prone in thoracic extension. And then I go ahead and cue my patients by if there's a hair out the top of your head, it's pulling towards me. Yep. So that's getting length in the spine. So I'm going to have them go ahead and make a double chin. So bring that chin to your chest. Good. While maintaining that long spine and relax. Good. And double chin right here. Good. And relax. If your patient is able to, you can add a TheraBand. So right around the back of their head, you can hold these. Hold these.
Oh.
And again. Good. And so this just, again, adds resistance to this deep neck flexor exercise. So now we're moving into manual therapy, and first I'm just going to show 4 scalenes. So your scalene, remember, runs from the transverse processes on your spine down to attachments in the first rib area. So I go ahead and put my patient, I have them supine, head off the table. I'm going to rotate them, and I go ahead and use my forearm to support their head. I can even have my hand at the base of their neck to get more of that forearm support, and usually I'm seated. But what you can do is I take my thumb and I put some lotion on here, and all I do is I run, starting from right behind the back of that ear, and I run my thumb very lightly just down behind or posterior to the sternocleidomastoid. And you can just go in motions there, being aware of the carotid artery. Also, if someone has a positive vertebral artery test, probably don't want them in this position. And same parameters as you would for your normal manual therapy. For my traction and rotation, I go ahead and use a lumbrical grip with my fingers flexed at the MCP joint. I'm going to find the occiput, and I just apply traction, and then from there I'm using the transverse processes and guiding them into rotation, and I just alternate one and then the other. So rotation right and rotation left, rotation right, rotation left, and I just am guiding that, and I try to get them, before I do this, I get them to relax their head, and I'm really applying some good traction and some good rotation. You can also do this at different levels, but ultimately you will slide back up to that occiput. Almost like a figure 8 motion. For our scalene stretch, we're going to go ahead and put your hand on your collarbone. So go ahead and put your hand on your collarbone for me. You are going to depress that hand towards the floor. You are going to take your chin up and away from that hand, and you should feel in the front of your neck a really good scalene stretch. This is really good for people who are sitting on Zoom all day, or sitting on their phone all day, reading, anything in front of them, or if we just have just tension in these scalenes. So lastly, I'm going to show you what I do for my patients and athletes when they are complaining of upper trap tightness. I just use a single tennis ball. This is like magic. I actually do this on myself too. A lot of times if someone wakes up feeling like they have upper trap tightness, or they just have some spasm or stress, then you can go ahead and do this. All you need is this tennis ball in a doorway, and you do 3 motions. So what I do is I first set up the tennis ball, usually around my hip. For someone with tighter hamstrings, you're going to want to make it a little bit higher. But essentially what you want to do is you want to get this tennis ball to be on the top of that upper trap. So I'll put my upper trap on top of the tennis ball, and then I'm going to push my weight into the doorway. So the more pressure I put into the doorway, obviously the more pressure I'm going to get on the upper trap, so you can adjust that pressure. And I'm going to do 3 motions. So the first one is yes, up and down. You can do that 10 times. The second one is no, left and right. And then the third one is chin to shoulder. And I always tell them you'll know which shoulder to do, because if you do chin to the opposite shoulder, you'll hit your face on the wall. And I usually get a good laugh out of that.
So hopefully this video gives you some ideas as a patient presents with neck pain, gives you some ideas of, okay, what special tests can I do? How can I treat this? What exercises I can do?